And let's move to the Ashanti region, where the Regional Health Directorate has been briefing the media on the latest figures of the COVID-19 cases. 12 cases have been recorded in that region, with 2 persons dying. Chief Executive Officer of the Komfo-Anokye Teaching Hospital, Dr. Oheneba Danso, said 1 patient on admission for COVID-19 has been discharged after he tested negative. But measures are in place to keep monitoring her in order to eliminate all threats.
Until yesterday, we had 1 patient in there who have been managed by us since the 20th of March. And as you were told last week, this patient has been doing very well. And in fact, last week, Monday, a week today, we repeated her test. Because of her very good clinical outlook, the intention was to prepare her for discharge. When we tested on Monday, she tested positive. So we decided that it was better to still keep her in. We repeated the test last week, Friday, and the test came out to be negative. To be doubly sure, we took another sample for Saturday, and that has also recorded negative results. In fact, for this patient, the major reason for her admission to Komfo-Anokye was because of her own comorbidities. She had pre-existing conditions which made her a very high-risk patient, having contracted the COVID-19 infection. So she's been mobilized home, testing negative, very well looking. But prior to that, because of our clinical requirements, I sent a team together with the regional monitoring team to the home to look at the home setting, to see how best she will have a very well isolation setup, and that has been done. Every member of the household has been very well educated in terms of the protocols for having her back at home. Even though she has tested negative, she is going to remain in isolation for the next week or 2. And our team will be visiting her as she continues to take her fluids and other related vitamins and medications. But for now, we think that she poses no or not much risk in the environment that she finds herself. As I speak, at the weekend, we tested 3 more people. They all came out to be negative. And currently, we have 2 for whom samples are being sent to the KCCR for testing.
Dr. Oheneba, there, what PPEs have been important and a critical part of the conversation. While addressing that concern for PPEs for frontline workers, Dr. Oheneba said the hospital is not in short supply, but he admits, however, that calls to increase stock is in the right direction.
As we have all come to know, I think the key thing for us has been the care for the frontline workers, the protection. I am pleased to indicate that to date, Komfo-Anokye has not really suffered in terms of real shortages for the personal protective equipment. I think we could have more, because as we have always indicated, this is a pandemic. Probably we have not hit the peak yet. We don't know how far we are going to be stretched. So the call for more PPEs is in order, even though we have quite a good quantity in stock now. We have also designed a protocol for the use of the PPEs, because what we realized along the line was that there was some kind of misuse of PPEs, and especially in preparation for a more bigger exposition of the condition, we have to make a very judicious use of the PPEs. So we have actually designed a protocol which has been disseminated in the hospital as to who wears what and at what time. just to make sure that we utilize the PPEs in accordance to the protocol. And I'm sure that for you from the media, we all listened to the presidential broadcast last night. Another major concern has now assuaged the difficulties and the misunderstandings in the health sector, more especially among the health staff. I'm saying health staff because as has been clearly redefined. When we say frontline workers, it's about everybody working in the health sector today. And I mean everybody. My understanding is that even the private sector is covered. Because the point is that for a pandemic, any patient can appear anywhere at any given point in time. We want to assure and reassure and to embolden our staff just so that they will hold themselves in readiness to treat our patients. And the presidential package that came, as you heard, covered all health staff who work within the health sector of Ghana. I'm sure the details you know. In addition to this, is going to be that core frontline. In fact, I have said in conference that all of us are frontline staff. But the fact that we come to work, and for somebody's work, he has to wear a headgear, head cover, nose mask, overall, special boots, distinguish or differentiates the kind of work and exposure that we are all coming into contact with the condition. So those are the kind of differentiation that you have over there. I must say that we are very, very grateful, especially for those of us managers at the various facilities, because the presidential offer or package, for me, will go a very long way to actually assure our staff. Not necessarily because they want to risk. I have always said that these packages come to motivate us and to get us very well refreshed in terms of our commitment to the work. But more importantly, as I have always indicated, is our personal protection. Because if you even fall sick and you get all the money in this world, I don't think that is what we are looking for.